Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith Rogers, producer of Public Health on Call, with a message for our superfans. Do you often listen to Public Health on Call, share episodes with your friends and family, or use episodes in your teaching and learning? Would you be willing to speak with us so that we can learn more about what you like or what you'd like more of from us? If so, we'd love to hear from you. Email us at publichealthquestion@jhu.edu by August 30th and let us know that you'd be interested in providing some feedback. We can't wait to hear from you. Thanks so much for listening.
This is Lindsay Smith Rogers. Today, Violence Reduction Councils. These groups bring together first responders, community-based organizations, lawmakers, and others to crunch huge amounts of data to pinpoint how homicides and shootings could be prevented. Dr. Mallory O'Brien, an assistant scientist with the Johns Hopkins Center for Gun Violence Solutions, joins us to talk about a new toolkit she and colleagues developed for the Bloomberg American Health Initiative that helps these groups organize and save lives in their communities. Let's listen. Dr. Mallory O'Brien, thank you so much for joining us on Public Health on Call. Today, we're talking about violence reduction councils. Can you walk us through what those are?
Absolutely. Thank you for having me, Lindsay. So Violence Reduction Council is really a framework for communities to be thinking about violence prevention. What we've learned over time, we, myself, and my colleagues, is that for violence prevention to be sustainable, to be coordinated, to be done in collaboration with all of the individuals involved in violence prevention, you really need this framework and structure. And so a Violence Reduction Council provides communities with a leadership structure, with a framework for reviewing data, both aggregate level data and case specific data. There's an underpinning of a data infrastructure so that as communities are thinking about how are they doing with their violence prevention, they have the data to analyze, to support what's working and what's not working. And they have data to help them understand where are the trends, where should we be focusing. And it really allows them to work better together, creating trust, creating partnerships, and creating accountability to ensure that these prevention strategies, intervention strategies are actually developed and brought to fruition.
So you might have a community that has, say, a high level of homicides within, and maybe you could define what community means in this sense. And so you have a group of people that come together to form these violence reduction councils. And then who might be at the table at these?
So a community could be at the city level, it could be at the county level. And in some cases, we would recommend that jurisdictions really try and pilot this process in a geographic area. So a couple neighborhoods, really to get things working smoothly. The people that you're going to want to participate in a Violence Reduction Council is everybody from the frontline people that are engaging with people in the community, with violence that's occurring in their neighborhoods, all the way on up to decision makers. So the way the structure is set up is that you would have case reviews with frontline folks, frontline individuals involved in violence interruption, community-based organizations that are doing outreach, including community liaison officers, for example, within a police department. You want to have the people that are on the front line engaging. And I have found over the years that those individuals that are on the ground have the best ideas because they are seeing firsthand what's going on. And when we help them tease it apart and think about what could we have done differently that could have changed the outcome for this case and cases similar, you begin to be able to unpack what are those opportunities that we're missing, especially if we're looking at high-level aggregate data. It doesn't allow us to get really into the weeds with the right people to understand what should we be doing differently to make a difference in our violence reduction strategies.
Can you give us an example of one of those situations?
So this is an old one, but I thought it was relevant because it's something that has come up recently in my own community, and it is something that just occurred a week or so ago in Philadelphia. So we were doing our case reviews and identified that we were seeing a number of shootings and a number of homicides that were occurring at what were termed after-set parties. There are other terms across the country, but essentially it's a party that's promoted on social media. Sometimes it's after bars close, sometimes it's not. And it's a place where people know there's going to be music. There's usually a cover charge. There's a cost to the alcohol, potentially drugs that are being sold, and other things going on at these events. And so we decided, let's put a working group together or a subcommittee within the Violence Reduction Council structure to really get the right people at the table, people who may not be participating in the actual reviews, but can provide a lot of guidance on how would we implement a particular recommendation. So we brought a host of people together to think about how do we address these after-set parties. So we had folks from the community, we had people from various agencies within the city, including what was called the Department of Neighborhood Services, the energy company, and really thought about how can we address these. So there was a series of recommendations that came out around after-set parties. Some of them were monitoring social media to identify where these parties were going to occur. We found that oftentimes it's the same promoters that are having the parties. So ensuring that they may have the proper paperwork because they are essentially acting as a bar. So what is the licensing requirements? Having awareness in the community, doing an awareness campaign. Hey, these parties are happening. People are being shot and killed in these events. And so it was really a multi-pronged approach with lots of stakeholders to figure out what do we do to prevent these kinds of shootings. And, I think when it was working. But unfortunately, what we see too often is people move on to different things and the effort. And this was in 2014. So this was a long time ago. But it's interesting to me that this is something that's still happening today, and to really reinvigorate that work group is on my list.
It's interesting because we so often frame public health in terms of these massive populations, right? But what you're talking about really is a small group relatively with a very specific intervention to prevent violence. You and your colleagues have kind of taken this work and created a blueprint so that this can be done at a massive scale. Can you talk about that a little bit?
Yeah, thank you. Recently, we released a new toolkit and a website that really details how to develop a violence reduction council. So it will walk individuals through, and we purposefully made it a website and a document that, depending on who you are, you can pick the document up and it will provide guidance specific to your needs. So if you're a mayor or you work for a mayor's office, you can read a particular section on why this is important, who needs to be involved, what the role of the mayor would be. And so we've released this. It's really rethinking some of the work that I've done over the years. And my colleagues, Cass Krafasi was my partner in really creating this new document. And the guide is designed to outline, first of all, what is the Violence Reduction Council? Then it's focusing on how do you build strong partnerships, because these partnerships are critical. really for information sharing and coming together to think about those new strategies that we need to think about. The involvement of community violence intervention programs and the community-based organizations. How to plan. So in the nuts and bolts of how do you plan a meeting? How do you facilitate a meeting? How do you collect the data? And then finally, how do you develop those actionable recommendations once you've had the opportunity to start reviewing those cases and review that aggregate data? And then we've also included an evaluation tool for teams, because so often when we do this work, there's a common council or a county board that wants to know, what are you doing? And so it is a tool for communities to help them move that agenda forward. And then the last thing that we've created that's part of the tool that I am super excited about is a Violence Reduction Council data system, not just a database, but a data system. So it will allow a community to capture all kinds of detailed information on the homicides and the shootings that are occurring at a level they've never been able to collect before. Because when they're doing these case reviews, they are getting data from all of the various partners. So it is more robust than just looking at any one data set, because it allows us to look across the data sets at an individual level and at a location level. And there's also a section that really looks at the community context. So what do we know about the community? And then finally, there's a section that allows for the recommendations that are being developed. So you have a place to put those recommendations, who's working on them, what's your timeline, where are you at? So if somebody from the Common Council or the mayor's office or the community wants to say, what's going on? You have a quick, easy way to do that. So it really helps build out this robust data. And we've created it in such a way that there's no cost to using the data system, because you don't have to pay anything for it. And we're in the process now of building out some standard reports so that if communities don't have the capacity to do the analysis themselves, we will have some reports for them to use. But I think one thing that's really exciting about this whole council is that you no longer will have just data, say, from the police department on what do we know about the investigation of the case. But now you're going to have input from all of the criminal justice partners. You're going to have input from city government in terms of what do we know about the neighborhoods? What do we know about what's going on with owner-occupied? What do we know about proximity to schools? What do we know about potentially education around the individuals that are involved? What do we know about community-based organizations and what work are they doing in the community, in the neighborhood where these are occurring? Are there opportunities based on that data for us to really think about working better together and coordinating and collaborating across all these systems to really build out some sustainable prevention strategies?
So what you're really talking about is a very focused methodology at trying to bring a lot of these different players to the table and have informed conversations about what's really going on and what could really help to prevent violence. Who might be the initiator of these councils? Like, who might be the person driving them forward or even starting them from the ground up?
So that's a great question. We would recommend that the agency that takes this on is considered neutral, that has an interest in violence prevention, but is seen as neutral. So sometimes it's a health department, sometimes it would be an Office of Violence Prevention, sometimes it might be a community-based organization that is focused on violence prevention. Because the data that you're going to want to capture is sensitive data in some instances, having somebody who's considered neutral and trusted to capture that information is important. And having champions is really important. So you could have somebody in a health department that really understands this and really wants to push it forward. And then they may seek out additional partners that also can be champions. So it may be that it starts in public health and they reach out to somebody within a violence interruption community-based organization and they have a champion there. And then they may reach out to somebody within a police department and they can get a champion there, really to move people forward. Because the biggest, I think, addition that a council brings is a way to bring your data together and understand your data. And so having that neutral agency to collect the data, but then you also have to have a neutral convener so that when these meetings occur, people feel like they can share, that they have a voice. And so there's a lot that goes into who's your facilitator, because somebody has to lead these discussions and that individual should also be seen as neutral and trusted and be the kind of person that asks the next question to get people to, okay, well, what could we have done? What, I hear you saying this, and how does that fit in with this? And then where do we go with that? And is there something there? Is there a kernel there of something we should be thinking about doing differently that will lead us to a recommendation? So, and then taking that kernel to the appropriate subcommittee to help you think through, okay, how do we make this into a bigger recommendation? And then who needs to be at the table to help us fine tune it and think about moving it forward?
And just to bring this whole conversation home, all of this is in service of the idea that violence is preventable. Like this is all happening not just to respond to violence that's happening in the community, but to prevent it from happening in the first place, right?
Yes, we probably should have started with that. Yes, I think that is the premise, is that violence is preventable. And my opinion is, and I've seen this in action, that you can look at a case and say, based on the facts that you have in front of you from the investigation, that, oh, this isn't preventable. But if you do more, if you bring more data to the table, you quickly see that there were opportunities to intervene and prevent. We just weren't sharing all of our data at the right time to figure out what could we have done differently. Yes, violence is preventable.
Dr. Mallory O'Brien, thank you so much for joining us.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.